A 33-year-old female with a past medical history significant for gastroesophageal reflux disease and hypertension presents to the emergency department with a hard pimple on her right leg that is erythematous and painful. Currently, erythematous area is about 200 centimeters squared. This has worsened since she has first noticed it several days ago, which brought her into her physician. She reports a rash to sulfa allergy in the past. Her current medications are lisinopril 20 milligrams daily, fluticasone 1 spray each nostril daily, and Ortho Tri-cyclen 1 pill daily. Her vitals are following: blood pressure 100/60, heart rate 110, temperature 102.3, respiratory rate 14. Local MRSA rates are 65%. The decision is made to admit the patient to the emergency ward for management. Which of the following intravenous agents, in addition to sealage or drainage of the abscess, would be appropriate to treat her acute bacterial skin structure infection? Select all that apply. So the key to this question, they're asking what drugs treat MRSA, because why else would they tell you this? Local MRSA rates are 65%, very high, right? So we want to find a drug that treats MRSA. Methicillin-resistant Staphylococcus aureus. That's what MRSA stands for. So anyway, you don't need to know any of the vitals. I mean, clearly they have a fever, temperature 102.3. That obviously shows that they have some sort of infection, likely. And they have a hard pimple. Well, they tell you here anyway that's to treat an acute bacterial skin infection. So you know you're treating a skin infection. So next, you're gonna go through all the answer choices here and try to figure out which of these treat MRSA, which I call MRSA. First thing you want to look for is allergies is the most important thing. You see here that says here she reports a rash to sulfa medications in the past. So we know she has an allergy. This is a true allergy to sulfa. So any drug that has sulfa in it, you cannot use it because she gets a rash, which is a true allergy. Most likely on Naplex, anything they say that they have some sort of reaction, it's probably going to be a true allergy, because obviously there are some fake allergies like side effects, but almost every time when you see a sentence that says they get some sort of reaction from a medication, it's going to be a true allergy. So first choice we have amoxicillin and clavulanate, also known as Augmentin. So this does not treat MRSA, so this is not the right answer choice. Ceftriaxone does not treat MRSA. They try to trick you because there is one cephalosporin called Teflara that does treat MRSA. Vancomycin treats MRSA. And make sure this you choose if they tell you like the dose or anything, make sure it's the IV route. Only because the oral treats a C. diff. So you can't use oral vancomycin because that won't work for skin infection. Only the IV formulation works. Daptomycin also treats MRSA. And Bactrim, it does treat MRSA, but the reason why you can't use it is because they have an allergy to sulfa. So that's why you can't use it, because allergy to sulfa. And obviously Bactrim has sulfa in it. You can just tell by this word, sulfamethoxazole. That's how you know it has sulfa in it. So that's it for this question. So you can stop the video now, but I'm just going to explain to you what other stuff about each of the other answer choices that you have to know. So for Augmentin, make sure you realize this only comes orally. And the most similar IV drug that's similar is called Unison. It has like almost the same coverage as Augmentin. And the generic name is for Unison is ampicillin sulbactam. Ampicillin sulbactam. Ceftriaxone is a third generation cephalosporin, so always watch out for penicillin allergy. And remember I said there is one cephalosporin that can treat MRSA. It's called teflaro. And next answer choice, so vancomycin. Make sure you know it's the IV route to treat the skin infection or any other infection. Oral only treats C. diff, which sits in the stomach. For daptomycin, what you need to know for the board exam is that make sure don't use for MRSA pneumonia. That's because this drug, daptomycin, it binds to the lung surfactant, so it'll inactivate it. That's why you cannot use it for pneumonia, MRSA pneumonia. Any type of infection like skin infection you could use. And so Bactrim, they always try to trick you because sulfa allergy. Always watch out. If the patient has sulfa allergy, you cannot use Bactrim. And so the drugs that you need to know that treat MRSA, I have here written down. Vancomycin, and then I also wrote the most common brand name that you have to know, like linezolid, Zyvox, daptomycin, cubicin, ceftaroline, which is that 5th generation cephalosporin, it's teflaro, clindamycin, Cleocin, Bactrim, and doxycycline. So make sure you memorize that for the board exam. And if you have any questions, please leave it in the comments. Goodbye.